All right, well, we'll go ahead and get started. It's 8:32, so thanks for being patient with us as we all, sounds like almost all of us, deal with technology issues this morning. But we'll still commit to ending on time. So welcome to our March DSMES Utilization Sharing Call, where this month we're going to be talking about telehealth. This is Meredith with Pelican, Senior Quality Improvement Facilitator for the Diabetes Care Team. We are under contract with the Centers for Medicare and Medicaid Services to help the state increase access and utilization to diabetes self-management, both community-based education and the DSMES clinical services that you all provide, and that's what brings me to this work. Inka?
Good morning, everyone. This is Inka Deku here at the Colorado Department of Public Health and Environment. And what brings me to these calls is that we have a CDC grant to support our accredited and recognized programs in Colorado to increase access to participation in these programs. So we host these calls because due to the low prevalence of diabetes education among Coloradans affected by diabetes, the primary purpose of these sharing calls is to partner with you all to discuss barriers to DSMES utilization, share successes, and identify tools that may be helpful in increasing DSMES utilization throughout the state. So this call is intended for ADA recognized or AADE accredited program staff, but of course we welcome anyone to the call.
So just our usual housekeeping items, and it sounds like all of you that joined this morning have been with us before, so I'm not going to spend a lot of time here other than to say, if you wouldn't mind placing yourself on mute while you're not speaking with *6, you can also unmute yourself that same way, and also be sure to state your name when you have something to contribute. We hope to hear from all of you this morning in our facilitated discussion. So for this slide, we're going to try this again. We tried it last month and had a few challenges. So you'll see we used to have a map of Colorado on this slide for you to place an arrow. So we're changing that up just to get some different type of interaction. So on the left side of your WebEx screen, if you hover your mouse, you'll see a squiggly line within a bar. If you left click on that squiggly line, and then click on the text tool, which is T, up towards the top, choose a color, and then come over to the slide, left click, and type your name, your organization, and the town or city you're calling in from. We'll give that a minute to see if we have better luck than.
And Meredith, this is Inka. Would you mind to share with me who is on the call when everyone clicks their name on the slide since we're not connected?
Oh, yeah. Yep.
Thank you.
So Becky is with us. Kimaris from Southwest Colorado. Roseanne is here, and Jana. Do we have anyone else on the line? All right, very good. I see all your names popping up, so thank you for doing that. We just like to test this functionality as we think about how we can gain interactive functions in future webinars, so thank you. And then Roseanne, I believe, actually I'm not seeing Roseanne yet, but just for the sake of time, we'll go ahead and move on.
I typed myself in there.
Uh-oh.
I'm kind of buried.
Left click. There you go. So that's the trick. Once you type your information, apparently you have to left click to get it to show up. Good. Great to see you all. Thank you. All right, Inka, so for our objectives today. Uh-oh. Okay, you may be on mute.
Yep, I'm on mute. Thanks. So I'm excited to introduce the Colorado Telehealth Learning Collaborative, and we have a special guest here in the room with me, Ashley Heathfield, and she'll talk to you about that, and so stay tuned. And then we will also have a facilitated conversation on understanding the current landscape of telehealth services for diabetes education in Colorado. We have some updates for two of our GSMES programs that will talk about how they're embarking on telehealth.
Great. Okay, so for the polling question today, we'd like to know, to what extent has your DSMES program considered using telehealth? You currently use telehealth and are considering ways to expand. Currently use telehealth and have no plans of revising. Are in the planning phase of using telehealth. You are just starting to research telehealth as a possible addition. Haven't yet researched telehealth. Have chosen not to pursue telehealth at this time, or other. And if you chose other, let us know what that might be. And I'm going to go ahead and open it up here. And for anyone on the phone only, do you want to share what your response would be?
Meredith, can you hear me?
I can.
Yeah, this is Kim, and somehow it's letting me participate in the poll.
Oh, great.
So I'm on the web instead of just the phone. Hey.
Sounds good. Okay, so we have one just starting to use and a few of you that haven't yet researched that. So thank you for sharing that. Helps inform our discussion as we move along today. All right. Ashley and Inka, I'll turn it over to you.
All right, great. Thanks, Meredith. So hello, my name is Ashley Heathfield, and I am the Chronic Disease Health System Specialist here at CDPHE. And because of recent funding from the CDC, we are forming a learning collaborative for NDPP and DSMES providers that are using telehealth or interested in using telehealth to discuss barriers and opportunities for successful and sustainable use of telehealth technology for organizations implementing these programs. Telehealth, as some of you may know, can help address issues of access and transportation barriers. Therefore, we want to gather information from the work going on both in the state and nationwide to inform a telehealth implementation guide for the provision of NDDP and DSMES programs through telehealth technology to assist organizations that are just beginning in this space and providing tools and resources to help be successful. So the Telehealth Learning Collaborative is going to be open to anyone interested in learning more about delivering DSMES and or NDDP via telehealth, and will be an opportunity to learn from other providers who are exploring the space, as well as gather resources and best practices for moving forward with this modality. We're thinking the first Learn Collaborative session or virtual call will be in early summer, and so if you're interested, please reach out. My email address is in this slide. You can also reach out to Inka. You can get your information to me. And I will add you to the list to make sure that you get notifications on when that's going to be scheduled for. But just to step back, the bigger picture is CDPHE wants to support the expansion of access to these two programs specifically, as well as support innovative strategies to do so. Telehealth is growing in healthcare in general. And so we think this could be an opportunity to see how starting with providing access to DSMES or NDPP could lay the groundwork for expanding other services that you may provide via telehealth as well. Thanks. Awesome, Ashley. And with our facilitated conversation, we're going to dive deeper into some questions around telehealth. So if you have any comments or questions right now, feel free to chime in or we can dive into the facilitated conversation.
All right. Inka, I do have the facilitated sharing slide up.
Perfect. Oh, so, well, first, the current telehealth landscape. Is that what you're referring to?
Okay. No, I missed that one. I just hadn't heard.
I didn't hear John. So I can provide an update for part of the Rockies Medical Center for John Fitz. Maybe he's having some technological issues as well. And then for the noon call, we're going to have an update from Tri-County Health Department. But part of the Rockies Medical Center is a cancer, cardiovascular, pulmonary disease grantee, and it's a CCPD grant program that's funded by tobacco tax dollars. For some of you that may not be familiar with our grants program here at the Health Department. And so they're a grantee doing NDPP and DSMES work through this funded grant. And so with that, they are going to be exploring telehealth with their DSMES. And so I just want to kind of just highlight that fact that they are grant funded, so they have a lot more flexibility in terms of how they can do telehealth. They can just pretty much do it because they're being funded to do it. Whereas if you were to explore telehealth for DSMES for Medicare, there's a whole reimbursement structure around that, which with Ashley's collaborative, that's one thing that she'll explore is the whole reimbursement structure. And so with John, it's really exciting because of this. It's kind of outside of the reimbursement. You're able to really the next. They're in their first year of their grant, starting their second year in July. Really being able to lay the foundation of what does it take for a DSMES program to start out telehealth. How much does it cost? Evaluation around that. And so it's really exciting for us that we're able to get updates from John from that. So I'm trying to think that here actually any highlights from their work, but I think this year they spent a lot of time just laying down the infrastructure.
Yeah, I would agree. I think you covered it well.
Thank you. Now we'll get into the facilitated sharing.
Okay. Thanks, Cynthia, for sharing that update. Okay, we're there.
So today we just wanted to, and this will actually really help inform some of Ashley's pre-work before this collaborative meets. And so based on the polling results, we have some questions related to those folks that have no telehealth services, those that are exploring or interested in telehealth, and then those that are just starting telehealth services. And so I think for those that are not exploring telehealth, did anyone on the polling results say that they're exploring it, Meredith?
Yes, we had one response for we're just starting to explore and two responses for haven't yet researched.
Okay, thank you. And so for those that are exploring it, how did you know or decide to pursue telehealth?
That was me, Kim Andrigo, and we are doing a telehealth with Barbara Davis Center in Denver, but we're doing it as a partnership with Pediatric Partners, so it's not really under our umbrella. And so we had a little bit of experience with that, and we've been looking at ways to maybe expand that to our other patients rather than just the pediatrics.
And when this partnership started, what was kind of the impetus to start the interest level? Is it because to address a barrier for your pediatric diabetes population?
Yes.
And were you involved in that process?
I was not. It started before I came on staff here.
Is other staff still there that were involved in the process that maybe we could reach out to and learn a little bit about how they set up that infrastructure or that partnership?
Yeah, I believe so.
Okay. Yeah, that'd be great to be able to connect with them. And then, so when you're thinking about expanding those services, what kind of work are you doing to just kind of make sure that this isn't like telehealth fits the is going to help the needs that you're seeing in your population? Like any kind of needs assessment, are you talking with patients or plan to, or not? Maybe not quite there yet. But.
Not quite there yet. We do know that some of our patients drive up to an hour to 2 hours to come see us, and so that's the main factor, is seeing if we can help out with that commute time.
Okay. Kim, is joining the collaborative something of interest to you?
Yes.
Okay, great. I'll get your head through and make sure that I send you communication on that.
That'd be great. Thank you.
Absolutely. And as you start to explore this, Kim, feel free to share any of your ideas with us as Ashley's going through this process. Yeah, or reach out for resources too. I mean, I'm learning right alongside of everybody else, and so as I come across things that I find, I'm so happy to share those. So yeah, if you have any specific questions, please reach out, and I'm happy to help with that.
Great, thank you.
Yep. So for those that are not doing it, would you provide us some insight as to why you're not doing it? Is it funding? Is it staff capacity? Is it knowledge of billing?
This is Roseanne. We're not doing anything with it, but we've kind of talked about it a little bit. Being a tertiary hospital, we're pulling in patients from a lot of rural areas, and so it seems like it would be a good fit to meet some of the needs of the population that we're serving on the inpatient side. But we don't know anything about it or what equipment we would need or that type of thing.
Are there any other services at your organization, Roseanne, that are doing telehealth?
I don't know.
And so when you say that you are talking about it, is it just like very general, high level?
Very general. Yeah.
Very general. Is it with other diabetes staff, or is it with more like hospital leadership that you're having these conversations?
No, it's just within our department.
Okay, within your department.
Mm-hmm.
What about others on the phone?
Hey, this is Jana. We have just been so focused on our in-person classes and, making those sustainable first that that has really been our main focus. And then just probably needing to know more about, like, the billing rules around it and, who even qualifies to get telehealth, how that would even look since we're not a rural site ourselves. I think it would take a lot of consideration, and so we're kind of working on our in-person program first.
Yeah, that makes a ton of sense. I will share that Sam from Tri-County has also come up with similar concerns about they're more of an urban area, so they're not running into the same issues that maybe rural populations do, but is exploring this as a way to kind of help folks that live in Denver with transportation issues. Obviously focusing on your in-person classes first totally makes sense, making that sustainable. But if you have any interest, again, hopefully this learning collaborative pulls in a lot of people from all over the state, and that way it's kind of a shared learning from, okay, this is the situation I'm in, and here's how we handle this situation and why it was a need for our population, as it'll absolutely change depending on who your target is. So.
Yeah, we would certainly love to learn more about it and just kind of explore it, definitely.
Inga, this is Meredith real quick. I just have to call myself out. I'm typing away on the notes in the wrong column, so don't let that. For those of you on the WebEx, don't let that throw you off.
All good. Yeah, this is Inga. I'm really excited that we have Ashley on board because this has been on my list of things that I've been really interested in learning more about, but it's a little bit daunting, and just trying to understand regular DSMS, Medicare, Medicaid billing, like to layer telehealth on top of that. And so I'm just really excited that we have someone here at CDPHE to move this work forward. And so just thinking about, I heard some of you say just not knowing about billing, not knowing even about like basic technology. What are some ways that we can share resources, education, or training that would help you feel confident in establishing telehealth services if you were able to? Like, what kind of time capacity would you have to participate? We want to make it as accessible to you as possible.
This is Janice. I certainly think it would be interesting to hear Tri-County's perspective on how they're working in telehealth, as a non-rural site. And then also, obviously trying to get around the sustainability issue of, if we are going to dedicate program resources to that, is it something that we can even generate money from? Because that'll be a big selling point for leadership here at Denver Health.
Mm-hmm. Jana, do you know what if other services at Denver Health use telehealth for other diseases?
I know that we do a telecounseling program, but they have also struggled kind of primarily with funding, and they've been chronically grant funded. And so now the program is moving to be student run, and so students on their social work or psychology rotation will run the program. So that's kind of the way they've gotten around the payment part of it. I do know that they haven't explored billing for it because it has been really complicated.
Mm-hmm.
And unfortunately, it's not, I think the program itself is limping by, so it's not necessarily I think everyone sees the value in it, but it's not necessarily a well-supported program at Denver Health. So perhaps not like a model, if I could say that.
Yeah, I would just be curious to know if health systems, your organizations have, and maybe you're just not aware of it, there's already conversations like some sort of internal telehealth group or internal telehealth collaborative already happening. I would just be curious to know if that was going on, just because it's bubbling up so much. But maybe it's not happening, and so I'm making an assumption.
Yeah, I can certainly do more digging for sure. I can reach out to the organizer of that program and see if they know of any other telehealth initiatives at Denver Health or any groups that are looking at the telehealth options.
Yeah, that'd be great. I think it wouldn't hurt just to, if you're doing the same thing with Kim and Roseanne, how would that look for you in terms of just asking around about other programs doing telehealth?
This is Roseanne. I think I'm going to do that and find out whether or not there is activities that's looking at telehealth and whether or not any other departments are doing it. One of the questions that comes to my mind is of anybody that does do telehealth, whether they be in Colorado or elsewhere, are they doing their in-person classes and the telehealth combined, like in everybody's meeting at the same time, or are they having a separate like class for the telehealth? I would be very interested to hear how people are doing that.
Good thoughts, Roseanne. We'll definitely capture those. Well, this was a great conversation. Thank you. We just have a few minutes, so I just kind of want to wrap up our call. So, are we, any last thoughts before we move on? Say something, Meredith?
Your next slide is up when you're ready.
Oh, thank you. So I'm really excited about our diabetes conference. It's not spring anymore. Is it still spring? June? I can't even know. I think it's still spring. It's spring conference, and like June feels like summer. So it's save the date. I will send those out shortly. But it's going to be Friday, June 7th at the Lowry Conference Center here in Denver. It's the same kind of deal as last year in the sense where it's a full day, 8 to 4, give or take there. It's free, no cost to attend. I am working hard to get CE credits through AADE, as well as the American Academy of Nutrition and Dietetics. And for those traveling over 70 miles, we will reimburse for travel and hotel, like we did last year as well. And so I just really hope, I encourage you all to come. I'm formalizing the agenda in the next couple weeks as well, so I'll send that out. Sorry, it's not Marianne Hodorowicz, but I think you'll be pleased as to some of our speakers. And yeah, just save the date. I really hope that you can all come. And then Sharon call for next month is April 17th, and we're going to continue turning the spotlight on you. Really kind of learning from best practices or successes you'd like to present, let us know. And then, of course, we have our resources, NDPP contact information, Becky DiOrio. We still have those technical assistance calls with Marianne. That goes through the end of July. So if you have not had one, I really suggest getting one before that contract ends. They're just super helpful, and next month I hope to get someone to kind of dive into a little bit more of like how her technical assistance calls really changed their program. And then continuing with resources, we have the CDPHE website, the CDC, DSMS toolkit, as well as our Telegen website and diabetes resources. Please don't forget to take the survey on your right-hand side, and of course, feel free to reach out anytime between calls.
And again, if you're interested in being on that call, Kim, I'll get your information, but for the others, if you'd like to be on the Learning Collaborative or even just listening in on those calls, please reach out to myself or Inga, and we'll get you on there.
And this is WebEx. This is Meredith. I am not seeing how to get the evaluation poll up. Can you help me out with that?
Yes, I'll pop it open for you.
Thank you. Thank you, everyone, for joining today. Great conversation.
Thank you.
Thank you.
Bye.
Talk to you soon.
Have a good day, everybody.
You too. Bye-bye.
The leader has disconnected. The conference will be terminated in 5 minutes.